So I have some of the drugs I'm supposed to show you. For example, if the birds are sick of these bacterial diseases, have here sulfur, have here oxy 25%, have here ambrolium, have here what you call macrolide or tylosin. So these drugs, for example, ambrolium, if the birds are suffering from a disease called coccidiosis. What are the signs of coccidiosis? Signs of coccidiosis find that the bird loses appetite. It is what called depression, or the bird starts chilling. Then another sign find that white droppings mixed with blood. Those are the signs of what? These signs of coccidiosis. So the drug you can use for helping you to prevent or to treat this disease called coccidiosis, you have what you call ambrolium. Ambrolium is a drug I use for controlling this disease called coccidiosis. So if you find that there's a mixed diarrhea, a mixture of droppings, like there's a white dropping, there's yellow, there's green droppings in the unit, which means that shows that there is a mixed infection inside the unit. The drug which helps you to control diarrhea is called sulfur-dimidine. So you get this 40 ml of sulfur-dimidine, you mix it in 5 liters of water. So it can help you to clear any diarrhea inside the unit. There are some other diseases also this sulfur controls, like for cholera, for typhoid, very many of them. So you find that when you mix this sulfur, it helps you to control the diarrhea in the unit. Then I have oxy 25%. Oxy 25% is given only this chicken bird, this big birds, but not the chicks, because the strong drug. It controls these secondary bacterial infections. For example, we have like what you see here. This bird, some of these birds are affected with a disease called infectious coryza. But I bought a drug called the sulfur also can work with the infectious coryza, but there's a drug called what's the name of this drug? But take it here. Yeah, I use a drug called erythromycin. Erythromycin also helps to treat a disease called infectious coryza. Infectious coryza, you find that the eye of the bird swell, and when you open it's over tears, and there are something like a pus coming out of that eye. But the smallpox, you find that it puts some wounds around the face. But infectious coryza affects the eye of the bird. It swells and it's over tearing. When you open inside, there's something like a pus. Those are some signs of infectious coryza. Some of other diseases you can read from class if you want to learn more. Thank you very much for listening.